Okay, thank you very much. For those who don't know me, my name's Dana Sternix. I'm an academic at UNSW, but I am, I think, an associate investigator of the CRE. Let's call it a friend of the CRE. And I'm very pleased to be chairing this session today on safer falling. I'd like to acknowledge that we are meeting, I presume we're all meeting on Aboriginal land. The land that I am on today is a land of the Bidjigal people, and I like to pay my respects to the people who have looked after these lands for the last 60,000 or so years, and just make point about how lucky I feel that I am to live and work in these lands. So welcome everyone. A reminder, can you please turn off your microphone? You can leave your video on if you like to, but microphone's off so that we don't have too much background noise. And we'll move on to introducing our speakers. Actually, let's move on to the next slide, where we can see our lovely two speakers today. The first is Dr. Stephen Fu, and he's a newly minted doctor. He's just finished his PhD here at Neura, and he graduates next week, I think. So on behalf of everyone, Stephen, congratulations. He did a
Thank
fantastic
you.
job with his PhD over the past 4 years. So we'll hear a little bit about that today. But Stephen is an accredited exercise physiologist, and he has been a PhD student here, but he's now moved on to be the New South Wales Fall Prevention Healthy Aging Network Project Officer. Prior to coming here, he had many years of experience as an exercise physiologist, and he was specialising in fall and fracture prevention down in Melbourne, actually. So he completed his PhD here at Neura, like I said, where he investigated how the body responds and adapts to slip and trip perturbations. And so that is what he's going to discuss today. I'm going to stop sharing my screen. And if you're ready, Stephen, you can share yours. And I will hand over to you. We hopefully will have some questions at the end, but let's see how we're going for time and whether we want to ask directly after Stephen's talk or more generally at the end of the two speakers.
Thanks, Dana, and thanks to the CRE for the opportunity to present today. My topic is based off, like Dana mentioned, a mini review that we recently published looking at how older people can learn to land safely to prevent fall injuries. And this was written as part of a series of mini reviews that the Fall Prevention and Healthy Network has up on our website. So I guess to start off with, we know that falls are a significant problem for older people. 1/3 of older people fall each year, and half of those age 85 years and over fall. In addition to that, falls are the leading cause of hospitalized injury and injury-related death in older people in Australia. And as we can see in this middle panel here, for the falls clearly outweigh all the other causes for injury-related hospitalizations. And on the right panel here, we can see that falls can be a significant problem across all age groups. So not only older people, but also those who are young infants and children, as well as those who are in their middle age. And if we look at the fall event, we know that there are three different stages for a fall occurring. So there's a destabilization stage. So this may be characterized by, for example, tripping on some uneven pavement, slipping on a wet tile, or losing your balance when you're getting up from the chair. After that, if you're not able to successfully correct your loss of balance, there's a descent phase and then an impact phase. And from this impact phase, an injury may or may not result. And what we know is that the majority of research looks at the recovery of balance. So, for example, if we look at Kathy's many reviews, there is a lot of evidence showing that exercise, for example, is an effective intervention to prevent falls, either by preventing this destabilization phase from occurring or helping the older person manage this this destabilization phase so that they're able to, stop themselves from falling or descending and hitting the ground. However, and there's little research on this safe landing area. So if you imagine the older person will still be destabilized. However, instead of recovering their balance, they may be able to perform various strategies to try and minimize this impact force and therefore the injury that can result from a fall. And we can see the different strategies that can be used in these stages. So in the destabilization phase, like I mentioned, exercise is the most effective intervention to prevent a fall by improving various fall risk factors, including your balance, your strength, and your mobility. And other risk factors may also be addressed at this stage. So correcting any issues with the vision or foot issues, and also managing the environment, for example, removing clutter or using like non-slip mats, those sorts of things. In the descent phase, there's really only the studies on looking at safe landing, which aim to investigate how we can reduce the ground impact forces. And then in the impact phase, the main strategies involve the use of various equipment. So this might be the use of hip protectors, which are effective if they are used, or compliant flooring to reduce that impact on the ground. So if we look at why safe landing is important and how older people fall and sustain injuries, in the community settings, there has been numerous studies, one of which was looking at the study population from the Baltimore longitudinal study on aging, and they actually found quite high fall rates, where 70% of older people who fell were injured. Bruising and swelling was the most common injury, and the head and the knees were most frequently injured sites. And surprisingly, similar findings have been shown in the long-term care settings. So there was a study which reviewed the video footage from more than 2,000 falls and more than 650 residents who fell. And as you can see in this figure on the right, the head injuries were not only the most common injury site, but there was also the greatest probability of having an injury if someone contacted the ground. And evidence shows that the body positioning is also important in the injuries that people can suffer from after a fall. So we know that fractures occur when the impact force from a fall exceeds the load-bearing capacity of the bone. And again, with a similar study reviewing the video footage from long-term care residents, what's been shown is that the position of the pelvis at the impact of the ground is important, where a posterior lateral position is related to a higher number of hip fractures. And so this sort of leads to, I guess, the beginning of interventions designed to try and minimize the impact on the ground and prevent injuries from falls. And one study looked at how the positioning of the knees could affect the hip impact forces. So they had young people watch video footage of how older people fell and mimicked the falling patterns of older people, which were categorized into three different components. So strategies being the knee together, the knee on the mat. So in other words, the knee contacting the mat or the ground first, and a free knee position where the hip was the primary point of contact. And if they were to compare the impact forces for these three positions, what they found was that there was more than 50% greater impact on the hip for the knee together and free knee positions compared to the knee on mat, which shows that, at least for hip fractures, that the body positioning again was important. This was also shown with the forward falls and the wrist impacts on the ground, which can often result in wrist fractures. And in this study, they looked at how, I guess, a simple instruction could influence the stiffness of the body as well as the wrist impact forces. And again, in younger adults, what they did was they had the participants perform or form a forward-leaning and forward-leaning fall, and they were instructed to either contact the ground with a stiff arm or use a catching the floor strategy where the aim was to slow the body down as much as possible and absorb the impact. And again, with this study, what they found was that the peak forces that were experienced at the wrist were 40% lower when using this catching the floor approach. And this showed that even a simple instruction was able to reduce the impact on the ground. So in 2017, a systematic review and meta-analysis was conducted to look at whether or not safe landing strategies could reduce the impact forces compared to other techniques, such as just landing with the arms out in front of you. And in this study, what they found was that there were 13 studies which looked at an intervention or a training program where the safe landing was practiced. And from there, it was found that the safe landing strategies, which were primarily focused on adapting martial arts movements, was effective in reducing impact forces. However, only one study was conducted in older people, which led to suggestions that more research was required. So this one study is shown here, and it involved the use of a judo movement. I think it's pronounced ukemi, which is a fall breaking technique. So you can see in the images on the left, there's 4 different techniques that can be used for falling in the backwards, sideways, forwards, and at the bottom here, a forward roll. And what they used in this study was they adapted this forward rolling technique, beginning from the kneeling position, and then taught older people how to, I guess, successfully perform this roll in case they did have a fall. So there was another study which sort of used the same movement, and you can see in this figure on the bottom left, where they repeatedly practiced being released from a side leaning position. And then the idea again was to practice this rolling technique. And what they found in both of these studies was that the hip impact forces could be reduced, which indicated a possible reduction in the likelihood of having a hip fracture. And there was some evidence for the generalizability of training. So if you were to train, for example, falling to the left and doing this rolling technique, it was able to be transferred to rightward falls. Another study has used this an adapted martial arts tuck and roll strategy. And this study has been recently completed. I believe the paper is in either the drafting or review stage. And what they did was they implemented 4 weeks of practice of this safe landing technique. And you can see on the right here an example of the progression where the study participants would start from a lying position and then progress to perform the exercise in a sitting and then a kneeling or standing position. And at least the early findings from this study that have been reported was that the participants felt more confident in managing their falls and falling safely. And especially they were more confident in protecting their head from injury during a fall. And if we look at a few other studies that are available, so there's two main studies that have been conducted. So one looking at how we can, both of them looking at how we can combine either conventional exercises with safe landing techniques derived from martial arts, or looking at how we can use the conventional exercises to improve the safe landing from a fall. So the idea of these two studies was to provide options for the older person. So in case they weren't able to successfully recover their balance, they were at least able to prevent themselves from being injured after the fall. So the first one was the judo for balance studies. And what was shown with these studies is, or what they did with these studies was they combined strength, power, and balance training with the fall breaking techniques. And this was derived from the same martial arts techniques that were mentioned before, aiming to prevent the injuries from sideways falls. So after a 12-week intervention, it was found that older people were able to improve their physical performance. This was shown in measures such as the balance scale. They were able to reduce their fear of falling, which was measured through a questionnaire. And they were also able to improve the performance of their safe falling techniques. And this was measured by a judo instructor. So from these studies, it led the authors to conclude that safe landing may offer a complementary approach to fall prevention programs, and that using safe landing programs were feasible and could be performed in the group environment. And the last study was the fall arrest strategy training. And in this study, they used a alternate approach where the participants performed more conventional exercises. So this program was designed to improve upper body strength and improve the trunk and neck postural control with an aim to optimize the forward descent strategies. So in this intervention, what they found was that older people were able to increase their upper limb strength and their range of motion. But not only that, they were also able to respond more rapidly to a perturbation. So how they measured the response times was by having an auditory cue, like a beep, and the older people were required to reach up and touch the wall in front of them. And the reason why this was important was because if you were going to have a forward fall, being able to reach up and have your arms in the correct position would be important to try and, I guess, not only catch yourself and prevent the injuries, but also to absorb any impact from the injuries, especially to the wrist. So in conclusion, what we found in our mini review was that safe landing techniques, particularly those derived from martial arts, can be learned in an effective manner to reduce impact forces on the ground among older people. And these techniques may complement proven interventions such as balance and functional strength exercises, and can form a comprehensive approach to not only prevent falls, but also to reduce fall-related injuries. However, there were a few areas for further research. So the first one was the real-world effectiveness for these safe landing techniques. So none of these studies have been conducted in the long term, and we are also unsure of whether or not these practicing these techniques actually does reduce the number of fall-related injuries. Another area of further research was the ideal population. So, as you can imagine, performing a role can be difficult for older people. So, the idea is that practicing these safe landing techniques may be more suited for those with better physical function or with low risk. And then finally, it's unclear what the ideal training protocols are for safe landing practice. As you could see, there were a lot of different strategies that can be used to prevent the injuries from a fall and even from the judo techniques, which could be used to absorb impact across different directions. But it's unclear if one is better than the other or if practice of all these different approaches is required. So that's the end of my presentation. There's a QR code on the left here that you can scan, which links to the mini review on that I've presented on today, as well as the mini reviews that we've also written up looking at pets, environmental interventions, and dementia, as well as other ones. And then we also do have other events that we run through the Fall Prevention and Healthy Aging Network that you may be interested in. Thank you.
Thank you very much, Stephen. Very interesting and quite comprehensive, given that the work is, little bits and pieces of work done in all those aspects of falling, the destabilizing, the descent, and then the impact. Okay, I think we should open up for questions and spend the next 7 minutes or so discussing this topic. If anyone has any burning questions, please unmute your microphone and or raise your hand virtually to let me know. I can start off by just, a general comment in your 3 points for future research, Stephen. I was thinking, maybe it's a bit of a chicken and egg situation, but what is the point of understanding the ideal population and then the ideal training protocol if we really don't know if this type of thing can transfer to actual falls in daily life? And the studies that have tried to do that, it was nice to see some left to right transfer of the skill, but really these are in highly anticipatory sort of situations where people are leaning and know that they're going to be let go at some point. So this idea of what I need to do next is already pre-programmed, as opposed to living your life and unexpectedly having a trip and then needing to employ these strategies. Stephen, do you have any sense of which particular line of research or study best got to this question about can it transfer to daily life falls?
Yeah, so it's a bit of a hard one because, like you mentioned, none of these studies have actually looked at whether or not it can transfer to daily life falls. But I think, I guess it's sort of an area of progress. So there, like I mentioned, there's the evidence of the ground reaction forces being reduced, and that I guess the way that you fall can be linked to the injuries that you can suffer. Whether or not
Potential, but
yeah,
again, those are in very highly controlled lab settings, right?
yeah. Yeah, so I think in my mind, I think it might be something that could be difficult for older people to train, especially if you have someone who's frail. They might not have that capacity to perform those movements. And then another thing is, I guess, if you're imagining like that safe or the absorbing action, it can be difficult to, I guess, divert to that action when you're encountering something that's unexpected. So,
Okay, Kathy has a question. or comment?
Yeah, such a lovely, clear presentation. Well done, Stephen. Yeah, I think you just basically highlighted my question then is about the challenges in sort of frailer, more osteoporotic people who, potentially have the most to benefit from these type of strategies, but then, the challenges for how we actually safely investigate these type of strategies in the this high risk population. I mean, given you've looked closely at the studies, would you like to comment on that?
Yeah, so a lot of the studies that have been conducted were either, as the systematic review showed, either in young people or healthy older people. So I think at least for people who are more frail, there probably is a baseline level of strength and mobility that's required to be able to perform those safe landing techniques. But I think probably at least like from the forward falls, probably like a simple strategy would be to try to, I guess, aim for reducing the impact as much as possible. So.
And I think some of this relates to the work you've done for your PhD, Stephen, in that if you have a destabilizing situation, there are things that we can do to catch ourselves or to reduce the impact in and not necessarily not necessarily fall, but if we do fall, we fall in a safer way. And so those responses are very fast, right? There's not a lot of time between receiving a perturbation and landing on the ground. So you really need to have the right sensory motor cognitive functions at the ready to execute very promptly. So can you comment on that? Because I know you've looked at very rapid responses to perturbations in the lab.
Yep, sure.
Contribute.
So, yep. So I guess what we've shown in throughout my PhD was that doing a program where repeated perturbations are practiced, you can actually improve the response times. So you're able to contract the muscles or activate the muscles a lot quicker and more appropriately to respond to a perturbation such as a trip. So I guess in that sense, having programs such as exercise or perturbations where you're practicing specific fall event can also be beneficial where I guess you're sort of practicing the tasks that might induce a fall and you're better practicing the recovery patterns for preventing a fall as well.
Yeah, very interesting. And it's quite a challenge to do that well and make sure that it does transfer. Okay, a question from Tony. Do you want to unmute and ask your question, Tony? Thank you. Getting there. It's not still on mute there. Let's see if maybe Sandra, you can unmute Tony. I can't do it. Otherwise, we have to go to sign language or lip reading. Sandra, are you able to unmute Tony? Hi, Rick. Maybe we can hold off. There you are.
I'm terribly sorry.
Fine, no problem.
There is obviously a practical difficulty in training vulnerable people how to fall in practice. One of the ideas that occurred to me as you were talking, Stephen, sports people quite often use the practice of visualization, deep visualization, that doesn't involve any physical activity as such, but being put into a state where, in their mind's eye, they go through the process over and over and over again. I work with seniors in exercise classes, And in fact, yesterday I asked the question, how, if you fell and you had the chance to react before you hit the ground, what would you do first? What would you seek to protect? And they didn't really know. So, even if, some research points could be boiled down to 4 or 5 things, I think maybe as a research project, it would be worth exploring visualization in this area.
Very interesting point and good suggestion. Stephen?
Yeah. There have been visualization is a powerful tool. So there have been some studies, I think, published recently where they did use visualization as part of I guess a training approach to respond to an unknown perturbation or balance disturbance. And what they showed was that I guess visualizing how you would respond, or even watching videos of other people responding could be a potential way to teach people how to respond to a fall as well.
Okay. Yeah, I think that's a great idea to think further about that. We are at our halfway point, and I think maybe if there are more questions for Stephen, we can see if we have time at the end. But otherwise, you can always reach him via the New South Wales Healthy Aging for Prevention Network. Thank you very, very much, Stephen. It was a really interesting topic, and you always present it nice and clearly, like Kathy said. So thanks again for your talk. And if you don't mind unsharing your screen, we'll move on to our next presenter. Agathe, Daria Jadcazk is going to present next. And if you don't mind bringing up your slides, Agathe, that'd be great. Agathe is from the University of Adelaide. She's an exercise physiologist and a sports scientist from Germany, and is working as a research fellow now at the Adelaide Geriatrics Training and Research with Aged Care Centre, which is part of the Adelaide Medical School, the University of Adelaide there. Agathe investigates strategies to treat and prevent frailty in community dwelling older people, and she's collaborating with the University Judo Club, investigating how judo-based safe landing techniques can be used to teach older people to fall safely and prevent injury from harm. So it's a great topic to follow on from Stephen's overview. Agathe successfully completed a feasibility study and led a scoping review, and is currently conducting a trial on this topic. So we're very much looking forward to hearing what you've got to tell us about that, Agathe. When you're ready, we'll hand over to you.
Yes, I think I just lost the view I want to have.
Yeah, so if you just put it in presentation mode, then we're away. And while you're doing that, if I can just remind everyone to please make sure you're on mute, because sometimes there's some background noise that's...
Can you look at the presentation? Does it look good?
Perfect. You're on your way. Thank you so much.
Good, thank you. So yeah, thank you so much, Stephen. Great presentation. It's always great to see that work is being done in safe landing. And I will talk today about our program which is being done in South Australia. It's a Safe Landing Dynamic Balance for Life program to minimize harm and injury from falling. The team which one is involved? Oh, there you go. So you should see the key people now. So the key people involved in this research are Michael Hetland and Dr. Mara Verma. These are the 2 people who actually developed the program based on the 20-30 year experience in judo and also teaching judo across various age groups. And they approached me and Professor Renuka Viswanathan in 2009, so around 6 years ago, with the idea that their knowledge and specific judo-based safe landing techniques can be used to teach older adults to fall safely. So they started to see friends and family members fall more often with injuries, and they thought that maybe their knowledge can make a change. So it was actually a research project which came from the community, which is absolutely fantastic. And we also got Michael Peachy on board, who is a physiotherapist, and really helped us to make this program even more accessible and better. So I won't talk much about the background because I think Stephen did amazing work. Only one thing which really struck us as a research team was the last comment or the last data from South Australia, where SA Health revealed data that every single day, around 50 older adults are being hospitalized because of a fall. And when we look at the time right now, it's around midday. So approximately 25 people already ended up in hospital because of a fall today. And this really struck us in terms of we really need to do something to reduce the risk of injuries from falls. Despite having, falls prevention programs, balance programs, falls are still happening, and we still in desperate need to find novel intervention that work. So this next slide is very similar to what Stephen showed, which shows the domains of falls. We'll do it quite quickly. So we can see on the one side the falls prevention area, the pre-falls and the near falls, where there are quite a lot of balance and falls prevention programs working on this. So how to improve balance, how to recover from a trip situation. And then on the other side, towards the other far end, this is actually the post-fall situation when someone already fell down. And there are quite a few floor transfer programs who actually help people how they can fall and help themselves and how to come up from the ground. But the main gap is really still the safe landing, how to teach older adults to fall safely. And there are not many programs who actually looked into it. I think one major area is really the safety. Is it actually safe to teach older adults how to fall? And I'm really great that Stephen mentioned some of the studies which has been done, which we know personally as well from the Netherlands and Karin from Sweden. So the group is getting bigger and bigger to look into safe landing and how to do it. And our program really looks at the gap. So the Safe Landing Dynamic Balance for Life, which is now being implemented in South Australia, really looks at the gap of safe landing, but also has some components of falls prevention, balance recovery, and also learning how to fall safely, how to come up from the ground. So the principles of our program really focusing on lowering the height during a fall, really reducing the acceleration of a fall. Very important, increasing the landing area, the surface area when a person lands. And these are really the judo-based UCAMI landing positions which we use. So we use modified versions of the UCAMI landing position to increase the surface. So we can really protect the head, the hip, the neck, all those major bones and joints while people land. Another principle is really building up muscle strength, especially the eccentric muscle capacity. So people have actually the ability to lower themselves down and slow and make them fall a bit slower. And we also look at improving posture and balance to maintain balance when moving around. And there's also like a Japanese term called shizentai to really make sure that we maintain the center of mass while we're moving around. So these are the principles of our program. And I think Stephen had a very similar slide. So these are actually those judo-specific safe landing techniques which we use. We're using modified versions of that, but in our program, we teach 3 different landing positions or 3 different fall positions. So we're looking at backward falls, falling backwards, falling sideways, and falling forwards. And we're using those modified safe landing techniques to teach older adults to fall in a way to minimize harm and injury from falling. So when Mara and Michael approached us in 2009, our main questions were really, first of all, are older adults actually interested in learning how to fall and how to land safely, or are they just too scared to even look into this topic? Have any judo-based safe landing UCAMI programs be done before, especially for this demographic, looking into older adults? And is it actually safe to teach safe landing to older adults? So these were the questions we had, and we really did a step-by-step approach to answer those questions over the last 5 years. So to answer the first questions, are older adults actually interested and do they want to learn how to fall safely? We did a focus group discussion back in 2020 here in Adelaide, South Australia, and we invited 12 older adults with who were aged between 50 and 90 years. We really wanted to have different age groups to ask the question, okay, for what kind of population is this actually a good program? Who's really interested? So who's actually the ideal population? And we received especially positive feedback from those aged 65 years and older. Those who were younger, so in their 50s, they saw the significance and the importance of this program, but they just still had different priorities. They still haven't fallen. They still haven't had, it was not as important for them. However, those 65 plus who experienced a fall or saw people falling in their surroundings, they were the ones which really said, okay, this is important. We want to learn. We want to actually give this a go. And we also asked if we should bring the term judo in this whole program. Should our coaches use their judogi when they provide this program? And we actually got some positive feedback there as well, that they said, oh, if the judo coaches are wearing their judogi, it actually gives us more confidence that they really know what they do. So it was quite interesting for us and get really good feedback that, okay, there is a need and people are open to it here in South Australia in this older age group to do this. The next question was, has this been done before? And Stephen already presented some of the studies which we picked up in our scope and review as well. We've done this in 2021, I think, was when we looked at the studies, and we looked at any kind of judo-based UCAMI safe landing studies which try to improve health outcomes in middle-aged and older adults with no judo experience at all. So we really looked at, have there any studies been done who had participants who never done judo before or any kind of safe landing before? And there were at this time only 7 judo-based safe landing studies which focused on older adults, and 2 of them Stephen presented. So one was the Netherlands, Sweden, but also Italy and Spain published in this area. And 5 of those studies reported on safety and deemed the intervention to be safe, which was quite important for us as well. So they didn't have any serious adverse events when they were implementing those judo safe landing techniques with older adults. However, there was still nothing really in Australia, and we still have a bit of a different demographic compared to Europe. So there was still a need for a safe landing program for our Australian demographic. So, so what we did a little pilot study back in 2022, I think, where we really looked at the feasibility and the safety and the effects of this safe landing dynamic balance for life program. Because we really wanted to see, can we implement such a program, and is it safe to do that? We looked at different outcomes, all which are somehow related to reducing the risk of falls, like mobility, balance, physical function, but we also looked at fear of falling, which can really impact on people going out and also on their falls risk. We looked at quality of life and also their physical activity levels. We published this study in the Journal of Frailty and Aging. The program we developed is really a detailed lesson plan over 8 weeks. It can be done twice weekly over 8 weeks with 1 hour per session. In this little study, we had 17 community dwelling participants aged 66 up to 87, with the majority being female. We could see significant improvements in outcome measures like mobility, balance, and physical function, which are all important in reducing the risk of falls. We also had pre-frail participants, so 7 of those participants were at risk of frailty, and they showed even a greater improvement than the non-frail participants. So this opened up a little bit, almost maybe also answers this question, like what is actually the ideal population and who can we actually teach those safe landing techniques? And with this study, we showed that even people who are at risk of being frail can still benefit from this program. But the most important thing for us was there were no withdrawals, so it was feasible for all the participants to actually do the whole study, the whole 8 weeks, and we didn't have any adverse events, which answered our question of like, okay, it seems to be safe to do this program. So these were quite great results we got, and the conclusions from the last 3 studies was really, okay, the safe landing dynamic balance for life program can be delivered safely to older adults aged 65 years and above, including those at risk of frailty. I want to mention that the program has been developed in a way that can really be modified for different conditions as well. So while we still say that we still think that, especially for this demographic, close supervision is needed to actually deliver this program. So we're thinking about one coach has a maximum of 4 participants if the participants are quite healthy and physical capable. However, we're now starting to look into other options, working with people who have Parkinson, MS. We're looking at one-on-one, actually teaching the skills one-on-one with the help of allied health professionals as well. So we do think that this program can be modified to meet the individual needs and health system of people which are even more vulnerable. So we are at the moment trialing this kind of populations as well in a group setting. So we had here people up to 10, 12 people in a group. We think that one coach per 4 people would be ideal to work with healthy older adults, some of them at risk of frailty, but they were still quite okay. Another thing which we really want to stress is this program must be conducted on soft landing mats when they actually train those safe landing skills for a safety reason. Once they master the skills a bit better, they will go off the soft landing mats. But just at the beginning, because older people are just not aware of their movements as much, it's really crucial to have soft landing mats. And we could also see that this program seemed to be effective in improving physical function, with the potential to prevent other falls as well. In this study, we did not look at safe landing as yet because we didn't really have a tool or a method for us to be safe enough to actually examine safe landing at baseline. I think that's the most most sensitive time when we actually want to get older people in and just show us how you can actually land or how can you fall in a safe way. This has now been changed with the collaboration with the Swedish research group, which Stephen also presented. They developed a tool how we can safely measure safe landing skills, even at the beginning, with no one actually ever learned how to fall. So it's quite amazing, and we now validating this tool across different countries, and we're now using as well in our current study. So we're lucky enough to get some further funding from the Hospital Research Foundation Group to do a 2-year study, which now really focuses on not only teaching safe landing skills and actually measure how people can improve safe landing skills using this new tool, but also we got such a great response, and we have so many people who actually want to do this program that we are now looking at how can we actually upskill more coaches to deliver this program to more older adults. So we have 2 focuses with the study. One is actually train the trainer. So we are upskilling judo coaches who have no experience working with older adults. So they actually get qualified to work with older adults and teach those safe landing skills. But we also now open this program to allied healthcare professionals, especially physiotherapists, exercise physiologists, and OTs. And we upskill them, even though they have no experience in judo, we upskill them to teach those safe landing techniques to their clients. And this can happen one-on-one, it can happen in smaller groups, or they can also do it in larger ones. So we are upskilling those so more older adults can benefit from this program. And on the other hand, we have a larger group now of older adults in the study, where we really look at the safe landing skills and how much can actually those safe landing skills be improved. In this method, in the safe landing tool, we're really looking at any maneuver when they do the skill which might cause injury. So we're really trying to teach landing positions where the risk of injury is as minimal as possible. As soon as they do a maneuver which might impose a risk, we would stop the test and not go any further. So it's quite a novel tool which works really well, especially in this older population group, where we can measure safe landing skills in a safe way. Another thing what we just talked as well, like what are actually the long-term outcomes? We get questions as well, like, okay, you do teach those safe landings in a control environment. What is happening afterwards? So what we're doing now as well, we're actually following up all our participants over 12 months after they finish the course, and we ask them questions on the number of falls, if they had falls, and if there were any injuries, and what were the injuries, were there any hospitalizations, and also if they used those safe landing techniques they learned in the program. And we administered this survey over the phone. So we're calling the participants every 3, 6, 9, and then after 12 months to get a little bit of more long-term data, because there is still, as we discussed before, there's still not much on the long-term data. However, saying that as well is that some of our participants from the pilot study are still with the Dynamic Balance for Life program. Some of them have been graded the yellow and the orange belt. And we have a lot of anecdotal data where they show us, especially after around the 6-month mark, that they actually fall in a more safe way. So when they fall, they really use the technique and they don't injure themselves. So we are now at the moment collating all this data from people who are doing it now for a long time, so over 6 months. And it seems that they're starting to really automatically avoid injury. However, we don't have research data yet, but we're hoping that by hopefully getting another grant and also doing this 12-month survey, that we're starting to collect this data in a bit more robust way. Also, while we in Australia, or here in Australia, we're doing all this work, this as well. So got a lot of media attention as well, which I think is a great way to actually reach older adults and show them that there is a program to learn how to fall safely and to land safely. So there are quite a lot of news and other media articles which spread the word. So we are getting really good feedback and more interest from the older community to do this program. However, so while we're doing all this here in South Australia, there's also a lot of happening around the world. So there was the first conference on how we can actually use UKEMI safe landing, judo-based safe landing techniques in older adults have been done in 2023 in Japan. Mike Cullen, a professor from the UK, managed to get all the research groups together around the world to meet in Japan and really discuss how judo or how UKEMI or the safe landing techniques can contribute to reducing the problem of injuries, falls in older adults. So some of those research groups involved, they published, some did not, but it was just amazing to see that there are so many little groups working on this very important topic. And we ended up having 29 investigators in this first little conference. It was really just by invitation, quite small, but 14 different countries are looking into this at the moment. And they have their own programs, but they're all somehow judo-based, UKEMI-based. And we all work together at the moment to make actually a point what potential UKEMI or safe landing can have in minimizing the risk and impact of falls. We also outline recommendations for implementing those safe landings programs globally and highlight the importance of collaborations. It's really a collaboration between research teams, judo federations as well. So they really support us and support having teaching UKEMI to older adults and healthcare providers and community organizations, so we can really scale this up so more older adults can learn how to fall safely. So we are quite close connected with all those global teams. We're working together to have better tools to assess safe landing, safe tools to assess safe landing, and progress the evidence. So the evidence is growing to show, is it safe, is it effective, and so it's a work in progress, but it's amazing. It's amazing to see that there is a movement. It's amazing to see that the community is open to it. Our team also now, outside of the research, is training up coaches across Australia. So it's some coaches from Victoria, New South Wales. We're also now helping Japan to also implement our program there. It's quite helpful because we have a very detailed lesson plan which people can use and then adapt. So we are working on it to spread the word and really let people learn safe landing. So thank you so much. That's all from me. Thank you.
Thank you, Agatha. Excellent to hear about your work and the evolution of it, all the way to the consensus statement. So thank you very much for that overview. We have 5 minutes here for questions. If anyone has a question for Agatha, please go ahead. I was interested in the eccentric muscle capacity point that you made about, that is something that we really could develop. And I'm not sure that I know too many exercise programs for older people that does focus on eccentric work. But it makes sense that would slow a fall, and if we can get our eccentric capacity to be improved, then we might do a good job of preventing some injuries. Do you know that your programs are working on eccentric muscle exercises specifically, or it's just inherent in judo, do you think?
Oh no, so we are actually seeing this as one of a fundamental component in the program, because without eccentric muscle, it's really difficult to control and control lowering down. So this is a very important component in combination with the safe landing techniques which older people use. So in those over this 8 weeks, we're trying to do both, really work on the strength as well.
It'd be great to have an example. I'm sure people are wondering, what is your best example of an eccentric exercise?
The easiest exercise is really lowering themselves to a chair and do
a slow squat.
As slow as possible. Yeah. So usually we have like little competitions in our exercise groups, like whoever is the slowest wing. And this is something what they can really practice in a safe way at home as well. We do not recommend at all to do any of those safe landing movements at home, because they might be quite risky if they do it by themselves. But like especially sitting down and lowering themselves down to the chair and standing up again, this is something they can do quite safely and really supports how quickly they learn those skills as well. So very important component of the program.
Sure, you have a lot of people with very sore muscles the next day when they first get started on those things, but
yes. So they use muscles they never used before, So but the way the program is built, it's really gentle. So as I said, we didn't have any withdrawals, which just shows that we really just get the intensity right for them to be able to follow the program.
Yeah, good. There's a question in the chat from Karen. How would we be able to share programs in New South Wales with clients? Is there any database of where such programs are being run?
Yes. So at the moment, what we're doing a trainer workshop via Zoom, but we only collaborate at the moment with judo clubs. So because we think that it's quite difficult at the moment to teach allied health professionals those skills over Zoom. But they're more than welcome. So we had people coming from New South Wales to Adelaide to actually learn those skills. But at the moment, I think the best way would be either to get in touch with me, and I can let you know where in New South Wales at the moment this program, or where we actually training coaches, so they hopefully will pick up the program soon. So yeah, maybe just get in touch with me, because it's just starting. So it's probably the last 6-7 months where we really started to do the trainer outside. Yeah. So there have not been yet programs which started in New South Wales in Orange. At the moment, there will be 2 trainers very soon to start a program.
Good, watch this space. Okay, quick question from Jasmine to finish us off, as we're almost at 2:00.
Thanks very much, Agathe. Very nice work. I think I must have missed it, but did you say it reduced concern about falls as well in your group, or it's what you're finding, or?
So in our study, we could not see a significant reduction in fear of falling. We could see a trend, but not a significant one. We are not sure. Like in other studies, we saw that maybe a bit of a longer program is needed to really see improvement in quality of life and reduced fear of falling. So maybe our program was a bit too short, the 8 weeks, but there are indications in other studies that fear of falling can be reduced by these programs. Yeah.
Great, thank you. Thanks.
Excellent. Well, thank you very much. It's 2:00, so thank you all for hanging in there. That brings us to the end of our seminar. I'm sure there's another one coming up. Sandra, we're going to look out for Sandra's emails in a month's time.
Yep, probably so. Yep, month or 2 months. Yep.
About that. Well, thank you so much again to our speakers, Agatha and Stephen. Excellent seminar. Hope you all enjoyed it, and look forward to seeing you all at the next seminar.